everyone. I'm going to be doing another vlog today, and it is regarding a recent news article that I read on stuff.co.nz. So I saw it this morning, and it made me feel quite frustrated, quite sad, and quite emotional for those who are struggling by no fault of their own and that feel invalidated and somewhat rejected from society or let down. And I hear about this a lot. It's not an isolated situation. There have been, many individuals who have been experiencing the same thing, and I'm really, really happy that this individual happened to speak out about it on through the media. Now, so the topic that I would like to talk about is the WINZ program in New Zealand. So work and income. So the topic kind of relates to healthcare as well. So it's a illness benefit or a medical benefit. Also relates to the social determinants of health and basically increasing empathy in society. It's something that I believe that we need in New Zealand, especially due to the prevalence of mental illness that we have in New Zealand today. Now, so I'll read a few excerpts from the article in case you haven't seen it yourself, and I'll also post it in the below my video. So, now, the title was Illnesses Make It Hard to Live and WINZ Makes It Impossible. And this is coming from someone who has actually had the experience themselves. So unless you've really walked in their shoes, we wouldn't know what it's truly like. So this individual has two chronic illnesses. Chronic is ongoing, acute is an illness that may not last for a long period of time. Chronic illnesses are different, so essentially you are unwell for a long period of time. Like I said, it may get better at times, it may get worse at times. So yeah, it must be incredibly difficult. Now, often for chronic illnesses, there is no cure for either of these. The person who's speaking about this, there is no cure for either of them, no medication to relieve the symptoms and the pain that they feel constantly on a daily basis. So in 2016, this individual said that they lost their job and they were kept away from the workforce, and they were diagnosed with the second last month. So I'm unsure, has been forced to rely on WINZ to pay the daily bills. And now this is the part which really kind of made me feel very confused and upset. So she receives $380 from a job seeker benefit with medical deferral, accommodation supplement, additional support, and a disability allowance. I'm unsure where this person lives, but rent is $275, which is the normal amount that you'd pay for rent, especially if you have a chronic illness. Maybe he or she can't have shared accommodation, so therefore having a place of your own at that price is quite a low level of rent. The car repayment bills, $88 a week. I've actually read a few comments on here saying that there are people saying that having a car is a luxury. I believe if you have a chronic illness, it isn't a luxury because you need to have the ability to go to your appointments. Sometimes it's difficult. The accessibility to doctors, to healthcare clinics, getting your medication, going to the doctors, getting your prescriptions, going to hospital if there's an emergency, accessing people who can support you. I think that a car is not a luxury in that situation at all. I don't understand why people think it would be without fully understanding the situation or reading about it. It was almost like a few people had a bit of a knee jerk reaction and decided to say that, which appears to be quite unsympathetic, to say the least. So, from the amount that this individual receives, 363 is going on bills instantly. And that leaves this person with only $17 to pay for food, petrol, power, water, and the internet bill. And internet, and someone also commented saying that the internet is a luxury. It isn't in this day and age. People actually order their prescriptions online these days. They book their appointments online, especially if you have a chronic illness. Especially if you have anxiety, even getting on the phone or going somewhere to speak to someone can be a huge difficulty. And if you do have a chronic illness, having the internet is an activity. It's a hobby. If you are unable to do any other physical activities. So I'm basically just reading this. It upsets me because I just don't understand how people can think any differently, how people can think that this individual has luxuries when they do not even understand what type of illness this person has. So, and that only leaves her $17 as well, included with all of those bills for medicine. And medication is extremely expensive these days. First, you have to pay for the doctor to actually fax your medication to the pharmacy, which has a cost to it, and then you have to pick up your medication, so you drive to the pharmacy. You have to pay for the medication when you're there. I mean, you're very lucky if it's funded by Pharmac, but if it isn't, it's going to be extremely expensive. Now, so this person has made the effort to actually, this person's made the effort with people who work in budgeting to cancel every non-essential expense that they have. I'm reading off the article now. I'm just letting everyone know. It's just so in case anyone hasn't actually read it. I'm just kind of going through the important parts, which were important to me, or that I thought were quite relevant in the situation. The individual tried everything to lower their expenses to match their income. This person had to use every inch of credit that they can, withdrawn money from KiwiSaver, and borrowed from every friend and family member they have. So you can understand that this person is incredibly stressed. Anyone would be under this situation. Not only would the financial burden be stressful, but also the chronic illness would make it extremely difficult. To even have the ability to go and do these things while having a chronic illness and being so stressed, I think that is a huge achievement in itself. I see this person as being extremely strong after hearing their story. So the amount of debt this person is rises with each passing moment. That's not a way to live. Now, this person had to force her doctor to approve her to go back to the workforce, even though she has a chronic illness, and which is quite ironic, because if you do have a chronic illness and you tell your employer that you have one, which is sometimes required if it may affect your work, you probably are less likely to become employed or get that job that you applied for. So whereas there's no choice in the matter, it's just a terrible way to live, and it's by no fault of your own. If you unfortunately are diagnosed or you become chronically ill in some way, and society doesn't care for you or look after you, and people don't validate you, and people make comments online that say how it's having a car is like a privilege, when they don't understand that the need for a car for someone with a chronic illness may be completely different to someone else who can maybe walk to work or walk to the shops. Um, I have the ability to walk to the shops if I need to. I don't necessarily need a car, so possibly in some situations having a car would be a luxury, but in certain situations it isn't. Yeah, and not only that, I think just saying things like that is just quite cruel, to be honest. Especially since the amount of stress and hardship this person has been going through. Hearing comments like that would trigger some type of anxiety, stress, depression, anything. Anyway, I'll get back to the article now. So this person has been told to avoid stress. But yet he says, not sure. Yet every time a new bill comes up, or they need food, or something goes wrong, my stress levels rise. Inevitably, inevitably that would happen. That's just that would happen to anyone. And I don't understand how people can say to someone that they've been told they need to be told to avoid stress in their life when they've been placed in a position not by their choice. There are no social systems out there that can provide food, or no free social systems out there that can actually, or decent ones that can provide food, accommodation, or support, counselling, psychologists, therapy. There's a huge lack of that. I think that we need to improve upon our social systems. I think that's something that we clearly lack on, and clearly by reading this. Yeah. And she doesn't know how she's going to make it the next week. So she said that she had an unexpected medical emergency that came up, and she was forced to spend all her rent money on paying that bill instantly. And there was no option of setting up a weekly payment, no way of avoiding the medical emergency. So she went to work and income almost immediately, called them and told them of the situation. So she was told to go to WINZ, and the person behind the desk told me that I needed to be in areas and about to be evicted. This is the society we live in today, people, and it's despicable. She needed a letter of proof, something that she thought would be simple. They said that they waited until the head tenant got home, updated her on the situation, and she wrote a letter. So she went back, walked into the branch with the letter, only to be handed another stack of forms the head tenant needed to fill out and file. The person says, they are now looking down the barrel of my future, forever being a week in errors, anxiously waiting the next unexpected bill that will make me homeless. And we have a high amount of people who are homeless, especially in Auckland. I used to live in Auckland, and there are many, many people who are living on the streets. It leaves them vulnerable. It leaves them unable to move forward in life, because becoming homeless would affect your confidence. You wouldn't have any of those community groups. You wouldn't feel the confidence to go and see those community groups. Often people will say, why don't you find a job, to the homeless people? Why don't you find a job? Da da da. But they don't actually know their life story. They don't know that their confidence has been shut down. And these people have no understanding of what this individual has possibly been through. So I have friends who definitely have lived a privileged lifestyle. Their parents kind of help them out with everything, so they have zero understanding of what it may be like. I don't have an understanding of what it would be like, but I believe that listening to others' stories and validating their feelings, and if you are in a position where you can help, it's almost your duty to help. Yeah. Anyway, so she can't. She's been needing new clothes. She has debts, overdrafts, interest coming out of my ears. She says. He says. I don't know. She understands that WINZ needs to make it hard for those who simply are wishing to cheat the system, those that could work but don't want to. But what about those that have no choice? So there is a stereotype that people who are on the benefit, they have, they just choose not to work. That is not the case. That is not always the case. Now, I personally wouldn't blame someone in this situation who wanted to cheat the system, because the system has cheated them. Now, she said she has severe secondary depression, and every time a new expense comes up, she considers if living is really worth it anymore. She says people who open the pantry up to bread, tins, tomatoes, and pasta time and time and again, who have run out of people to turn to for help and options to try. They said that they understand why people would try to kill themselves, why people would commit benefit fraud or work under the table. This person can't afford health-wise or money-wise to make trips to an office to get more paperwork, and there's less help each time. She cannot afford the forest of paperwork that needs to be done, that's rejected again and again, to sit and talk with someone who thinks and acts like the person has no right to be there. They feel that their illnesses are looked at and their struggles are seen, but there is no offer to help. So this person can no longer afford to live. No quality in life, they state, in this pile of debt that they have no hope of tackling. And they say that it's impossible for those who truly cannot work, who are too ill to leave their beds, let alone their homes. And this is all this person is asking for, is a little sympathy and some help to make ends meet, to be able to afford new clothes or even op-shop clothes, to put actual food on the table and maybe start compiling some savings for when, savings for when something comes up, like the medical emergency this person recently went through. And she says that the illnesses make it hard to live and WINZ makes it impossible. And the problem is, as I stated before, she mentioned it's not just me in the sinking boat. So this isn't an isolated incident. This is happening everywhere. And I truly believe we need better social services. We need, like she said, he or she, this person is anonymous. They are mentioning suicide. And having suicidal ideation is a psychiatric problem. And I think people who have chronic illnesses need better access to social systems that are free, affordable, accessible, and that at least be able to speak to people who have an understanding of what they're going through and can maybe advocate for them or help them in some way, because the stress that this person is going under is most likely going to make their physical illness worse. So, having someone to talk to, or at least someone that understands, instead of these people that decide to comment all over Facebook about how they're just complaining, right? Some people just don't like it when people complain. However, these people don't understand that they have every right to complain. People who don't complain just stand still and put up with whatever they're given. And that's not right. I feel like this person is very brave and strong to be able to speak out about this problem. And I think more people who are struggling with the system, who are using the benefit, who are using WINZ, work and income, they should speak forward about their stories. They should come forward and they should they should talk about their experiences and how difficult it's been. So I never really understood when I was younger, when I was a teenager. I never really understood how people would get into a situation like this. I had no insight into chronic illnesses or mental illness or anything like that until I became a bit older and I started working in mental health. So as a mental health nurse, I see this every day. Many people, I can't really speak about people individually or use new identifiers because of confidentiality, and I would never want to do that. However, there are many people who come through the mental health system who were homeless, who go back to living on the streets. They're stressed, they're unwell, they're confused, and they feel let down by their country and by the people around them that are supposed to help. So, another couple of things I would like to talk about. This is going on a bit longer than I expected, 21 minutes. Okay, I'll finish up soon. So, like I said earlier, the ones that are privileged should at least acknowledge and validate individuals who have illnesses rendering them unable to work. A lot of people who are very, very right-wing will say that, it's your personal responsibility. You can work. It's your responsibility. Toughen up, or it doesn't help. It actually does the complete opposite. And I believe if they really did want to help people, they would try to understand the situation first instead of being so impulsive and impatient and making ridiculous comments that just bring people down. Anyway, so there have been a few different opinions on the post on Facebook, which I can actually have a look at right now. There are many people here, so saying it's incredibly disappointing and sad to hear about the experience, about the person's experience, and this is a great thing that this person said. It's a hand up, not a hand out. It's a hand up. It's just being a human being, just being kind and helping someone out, and this person obviously needs more help. Like, you can't argue that. Now, and here, so this is another person. So there are many people out there who don't actually validate and support this individual. So this person says, get rid of your car. Just get rid of your car. That is an immense expense for the taxpayer to cover for you. Do some courses instead of work. Oh my God, how can you possibly do a course when you have a chronic illness? You're probably stressed, depressed, you're suicidal. Oh, let's just do a course. That'll fix everything. Like, I can't believe that people can say that. If we look at people in society, if we are a society like this, if our country actually believes that this is an appropriate way to treat people, we are not doing well. We are not doing well. I'm not proud of our system at all. I'm not proud of our country at the moment. I am not proud of what's happening in society. And sorry about this, I'm just going through a few of these comments. I saw some before which were quite interesting. So there are people out there who don't want to help, who don't care, they just care about themselves. They don't realize that helping others can actually helps yourself. And I think we all need to be taught that. So this is another comment which kind of relates to that. So this person says she was homeless with her children, and the branch manager, this is in Auckland, said to her, "You may as well leave now because we are not going to help you." This is while she stood in line at the reception desk. So tell me again how the New Zealand welfare system helps those in need. Well, they don't. Not enough. Not enough. It's not good enough. It's just unacceptable. So, the last thing I would like to say before I get all emotional and weird. So, these are numbers that if you need help, if you are struggling, or numbers or contact details. So mental health, I've written here on one of my blogs that mental health illnesses are becoming prevalent in New Zealand today, and the chronic physical illnesses, like I spoke about earlier, will inevitably trigger stress, anxiety, and depression. And this person was having suicidal ideation, and that's heartbreaking. So therefore, I've put together, with help from my friend Ashna. She works in healthcare as well. She's a lovely person, and she actually gave me this number, which I didn't know about, and she said I should speak about it on one of my vlogs. So I've included that, and I'll read a few out now, and I'll also post them below. And here they are. Should have organised myself better, to be honest. Okay. Alright, so due to the increase, this is from the Waikato Police. So due to the increased demand for responses from mental health and social distress in New Zealand, Ministry of Health has set up a new helpline. Excellent. Great. I think that's an awesome idea. So you can call or text 1737. And calling can often be quite daunting if you're on your own. So I've had a friend call me because she didn't want to call EPS, Emergency Psychiatric Services, or she didn't want to call an ambulance, but she was suicidal. She called me. So, and I called someone for her. So often calling can be quite daunting for someone. Sometimes I even get nervous when I have to call people on the phone to book an appointment. It's just a bit of, social, I wouldn't call it social anxiety, maybe just, it's a bit nerve-wracking talking on the phone sometimes, but, we get used to it. But if you're going through mental distress, you can even text. And I know that a lot of adolescents these days text quite a lot, and they have access to their phones, and they may feel more comfortable about doing that. So you can call or text 1737 and connect with a trained mental health and addictions counsellor. The service is free and available 24/7. And like I said, it says down here, some people would prefer to talk via text. Yeah, talk via text rather than talk over the phone. So if you ever need help, 1737, text or call. Now, and these are mental health and addictions counsellors, so they are trained in speaking therapies, which I find awesome, and it's what we need more of. I mean, it's not as great as being face-to-face with someone, which would be completely ideal, but at least this is a huge improvement. I think this is amazing. So yeah, free call or text anytime. So yeah, I'm going to share that around online, and I'll put it below, 1737. Cool. And the other one was, so these are crisis assessment teams. So these are for emergencies. So I will put the link below on my underneath my vlog. So I'll just read out a couple now. So the Mental Health Crisis Centre operating 24/7. It's 0800 800 717. You've got your Southern, so 0800 467 846. One for Southland, press 2 for Otago. Anyway, I won't read these out, but they're throughout New Zealand, and they're all emergency psychiatric services. So if you ever feel like you are struggling, if you have a physical illness combined with a mental illness, which makes it a lot worse, a lot of mental illnesses can trigger physical illnesses and vice versa. So if you need help, these numbers are here for you. There are people out there that really care. Don't read the horrible comments on Facebook towards this poor woman who is clearly poor man or woman who's clearly struggling. Yeah, so I'm really happy that we have these outlets here that those can go to, but many aren't aware of them. I wasn't even aware of the Waikato 173, was it 1737? Yeah, 1737 number. I was not even aware of that until my friend told me. So let's get it out there for everyone who needs help, that you're not alone. Now, lastly, this is just something that I wrote before on my blog. Lastly, never forget that there are always people out there that are willing to help, like I said, regarding the phone numbers, and people that will stand up for you and validate your feelings, because feeling invalidated actually can cause a lot of stress and harm and make you feel alone. And loneliness is, it just essentially leads to depression, anxiety, suicide, personality disorders, even leading to psychosis. So if you are ever depressed, if you're feeling like you're hopeless, call those numbers, get help. I know it's hard, but you can always text, like I said. And often when an individual is depressed, everything is difficult to do. I've heard from people that picking up something can be just heavy. Moving slowly is another thing, or not being able to get out of bed. And that relates to both depression and anxiety, and they're also commonly coincide with other psychiatric disorders like schizophrenia or personality disorders. And the earlier that you treat it, we have a lot of great medications out there, a lot of great counsellors, therapists who can talk you through. And financial stress is also something that I've heard from a lot of my health clients, is for financial stress is making their mental illness worse, and they believe that. And if they believe that, it's their feelings, it's how they feel. So that is what I would like to speak about. So lastly, never forget that there are always people out there willing to help. And I'd like to say to everyone, let's have some sympathy for those that are struggling in society today. And that we understand that it is by no fault of their own. We need to understand that if you don't have a chronic illness, if you went to a good school, if you have a strong family, a strong family who you talk to a lot and you have support from, financial support from, you're blessed to have that. Use that to help others, because if we don't help others, what else is the point in life? That is our duty, I believe, as human beings. And I want to see New Zealand be a country that advocates for the most depressed in society. The most depressed, the ill, the ones that are living, that are homeless. We need to help these people. We can't live in a country and be proud if we let this happen and we don't say anything about it. So share this around if you like. This is just something I'm quite passionate about, so I like talking about it. This has gone on for 33 minutes now. I've been just ranting on, but I hope that at least a few people may watch this, and maybe I might hopefully change some minds out there about how we view people who are struggling and who are on the benefit today. So have some sympathy, people, have some empathy, try and understand, and remember, if you are going through struggles, you are never ever alone. There are always people out there to help you. So thanks for watching, everyone, and see ya.